Well, right now, officially, no about.
Okay, the one
All right.
or okay, my brother is in Novus Medical School in Tampa.
Sweet.
So if you ever have any questions, I can look it up. He's a second year. So he's surviving the last semester and then some shit and stuff.
All right.
He likes it better than I.
So, who read the article this week?
Halfway through.
Halfway through. Okay. So I'll just start with a little bit of presentation. So, the article this week is about how psilocybin mushrooms increase neuroplasticity, and then that increase subsequently allows psychotherapy to be much more effective. So, some of the results discussed is 50% decrease in depressive symptoms, 4 times more effective at relieving depressive symptoms than SSRIs, which are the current most prescribed type of drug for depression. And SSRIs also make you kind of like in a zombie-like state, right, where you're less susceptible to emotional connection. And there's also decreases in, say, sex drive as well. Whereas psilocybin, even months after distribution or intake, it still provides effects of increased emotional connection while decreasing depressive symptoms. And this occurs for months and years after the dose, and you can take subsequent doses to make the effect stronger. So I would like to ask the crowd, what do you think the potential implications of this are? Do you think there needs to be more research done, or do you think we should move forward currently in making this the sort of status quo for depression treatment? Or do you think even something non-drug related would be as effective as well? No hand raising.
Okay.
Go ahead.
Oh, okay. So what I think is, because currently this research, so far, what I've read so far at least, it's only been tracking results for at least what it seems to be an extension of 16 months or a year or so, a couple months, right? So, of course, it is a fantastic replacement for the current solutions. So it would be great to use it. However, I would think more research would be necessary just to see if there's any unnoticed / unexpected side effects to it. Because of course, and also not really side effects, but more so the side effects of using a higher dose. Because of course, using a higher dose will give a higher effect, but they might also cause more problems and solutions. So more research should be done to figure out what the perfect and most optimal dose to get the best and avoid the worst would be for scientific purposes. So that's what I would personally think.
I was thinking along the same lines. That I was of the mindset that maybe a couple longitudinal studies to see what the long-term effects of that sort of intervention is on, health, maybe brain development, or as we age. I think I agree with you, like optimizing, maybe getting parameters, like, all right, so what age is the efficacy, like, or I don't know, like we don't want to prescribe it to like maybe 12-year-olds who suffer from depression, and then maybe like equally as we would to someone who's like 60, or, and I know the paper mentioned like there was some positive effects with cancer patients who are maybe in a different state. Physiologically, neurophysiologically, I don't know if that's the case. I'm not familiar enough with that area, but it's worth considering. Like, how would like different patient groups? So I'm of the mindset that more research is necessary.
So yeah, I don't think necessarily we should prescribe it to 12-year-olds, but nor should we prescribe SSRIs. And I think to that end, we should look into more non-drug approaches, like increasing exercise, fresh air, sunlight. Like vitamin D is huge for depression. Can't really be supplemented effectively. Rishi, did you read the article this week?
Yeah, I did. My thoughts on it are, I think the main thing to focus on with these kinds of things is figuring out the mechanism of action of the mushroom, because that's kind of unknown right now. So I figure once you get that down, you might be able to tune different drugs to get the same effect without having the mushroom. So you don't have to prescribe psychedelics to kids, but you can prescribe something similar that has the same mechanism of action, just not a mushroom.
So we do see like effects of neuroplasticity, even at low doses that aren't necessarily like psychedelic. I mean, there are some psychedelic, like psychoactive effects. but it seems for like the big results and to get a very effective treatment, there seems to be something where the actual psychedelic experience is doing something for the depressive state, because you massively increase the neuroplasticity, and then it makes you have these sort of line of thinking where you're confronting these problems, and then that increase in neuroplasticity allows you to get past these certain mental blocks that maybe you weren't able to pass. But yeah, I definitely agree that if there is a way we can do this without doing that, that would be beneficial.
Because the way I understood it, it seemed like psilocybin is just a serotonin, it's basically mimics serotonin, and it also binds to the same receptors. So I figure if it's basically a serotonin mimicker, you can just engineer something else, right?
Yeah, I'm not sure about that. I know that like basically all psychedelic drugs bind to the serotonin 2A receptor. Yeah, it would be interesting to see if we research into other drugs that bind to that same receptor. Do all of them have psychedelic impacts? If so, why does just regular serotonin not? How would just giving someone serotonin affect them as well? Yeah, I think it does. It binds more strongly than serotonin, and that's why you see these effects that last in the case of like LSD for up to 24 hours, or in case of shrooms for like 6 to 8 hours.
So I'm curious, because I know you mentioned you're like, all right, we don't want to give shrooms necessarily.
I mean, I'm okay with like giving it to adults, and like pretty much anybody over, anybody who's done mentally growing, basically.
Right.
So as long as they're in that stage, that's fine. But I don't know about giving it to people who are still in the development stage, because while we do have research on adults, the effect on children, it's kind of unknown because they're still growing into that.
Right.
And a strong like as I mentioned before, it binds more tightly than serotonin and leads to these long-lasting effects. So maybe it's not a good idea to introduce something in there that does that, because they're just getting used to the serotonin effects when they're going through puberty, right?
I don't know enough about that, but I think I was thinking the same thing. Like we should probably study that. Now, how do you get a study through to see like how would we test that? Like how do you get to the point where you test it on a kid versus not? Like that seems like IRB is not easy.
Yeah, exactly.
Well, this is not a human kid, obviously, but you got rats, you got I don't know any other lab mammals that.
I think that's like mouse models are probably the closest to it, right?
Right.
Yeah, that makes sense. I don't know. I wonder. I know that there's a. So I was talking to one of the professors who works at he did model system stuff, and he's like, a lot of the research that we did it in mouse models, and then because it wasn't now this might be different because the investment potential might be much greater, but like for the stuff that he was saying, it's like for regulatory purposes, they're like, well, you did it in mice, but you didn't do it in people, so we're not going to necessarily regulate this because it might be more monetarily
Demanding.
yeah, there's more monetary benefit if we don't regulate this, so we're just gonna hush up about that. So, like, I'm curious how like the community, like not the scientific community maybe, but rather the sort of the non-scientific community would react to this kind of topic and that interplay.
So the capitalist community.
Yeah, I suppose.
Yeah, I mean that's definitely an interesting point, because when you're looking at if you're taking an SSRI, you have to take it every day for your entire life, right? And you become dependent on this chemical to feel any sort of not depression, right? Whereas with this, it's like we're seeing effects years later.
Yeah.
Where 80% of the participants still feel like better than they did before the trip, 6 months to a year later. And it's a mushroom. I mean, you can grow it in your house. Like, it doesn't take much.
Right.
I think it's because like it creates that experience. It's a whole experience instead of just like what's it called, managing your symptoms sort of thing.
Mm-hmm.
And in general, like our brain, we tend to remember things that have more emotions involved. And because psilocybin is more like it kind of connects you with the rest, but you feel kind of like this sense of like oneness or they've seen like an increase in meaningful relationships, like it says right here. I know like this, okay, so my brother and I like talk about this, or like sometimes when we like you drink or something, and then like after that, like you leave that with you've taken something from that experience, like maybe you're with different people and you kind of loosened up or whatever, or like other drugs. So, well, just I haven't done it, but don't worry. So anyway, just in general, I this is like more experience. I think this is based on like the actual experience the person has, and you mentioned something in the very beginning where you're like, is it because of psilocybin, or could it? I think you said like, could we do this non-medically too?
Right, like no chemical intervention rather than like just changes in vitamin D, so going outside more,
Yeah.
stuff like that, right?
Yeah, I mean, I'm of the personal belief that no one should take any sort of antidepressant drug unless they get sufficient sunlight every day, sufficient exercise, and they're working actively towards a career goal or some sort of personal goal and have a good like social network. I think if all of that is together, like you're doing good in your career, you have a good friend group, you're exercising, you're going outside, and you're still depressed, that's what antidepressants are for. And if you can have someone like that just take one dose like once a year, once every 6 months, I mean, that's far better than completely inhibiting all of their emotions and kind of making them into a zombie, like you were saying.
And one other thing that I was thinking about is that for the psilocybin effect that we're talking about is, sure, this research accentuated on, the positive effect, but it didn't mention at all, which is kind of bizarre, because statistically speaking, there has to be at least some kind of outlier, right? Of an individual that didn't have any change, or in the worst case, had negative change.
And that is true. There are definitely cases where there are negative impacts because psychedelic drugs affect everyone differently, right? A lot of people end up getting dissociated. Some people like that, some people really don't like that.
Yeah.
That's like 10% of participants in most of these studies. And that's why currently when you see like ketamine therapy, which works under like similar conditions where you have this psychedelic experience, you have increased neuroplasticity, and you combine it with therapy. I mean, you have to have taken like up to 3 different depression medications before you are allowed to do that in many states. But to me, I mean, if it's so much more effective than the SSRIs and it costs so much less and has so much less negative impact for the majority throughout the duration of the experience, I think maybe we should be looking at taking this before you go on SSRIs.
Yeah, I agree with you because every medication too, right, can affect everyone differently. So this could just be in that loop of things that they try. And like you said, it's only one dose, so like why not try it, see how it goes, and maybe that's all you need.
Right, and it's not like you're taking a dose like that a recreational user would take. You're taking a very controlled dose, and a lot of times these participants will take multiple doses, and so the first one will be very low, and then generally increasing. And anyone who has anxiety about it, they leave the study, and there's not really many long-term effects that I've seen.
Can it cause like addiction? Like what if that's a thing that can happen? Because and then like maybe that's something that needs to be studied, like withdrawal symptoms potentially, or like when they stop that.
So
yeah.
with the most popular form right now of psychedelic depression treatment, it's ketamine, and there is some addictive potential for that, but that's only if, say, your doctor gives you some to take home, right? Whereas this is like, with the ketamine therapy specifically, it's like once a month you go in and you have a psychotherapy session. You're not going to get addicted necessarily by that. And with psilocybin and LSD and that sort of class of compounds, there's little to no addictive potential. There's no dependence. There's no withdrawal if you don't take it.
My cousin has epilepsy, so she has medical marijuana to like help with her seizures. So I think it's a little bit comparable, and she's been using it for quite a long time. She's been okay. So
yeah, I mean, cannabis, a lot of people classify it as a psychedelic because it does kind of produce psychosis-like things sometimes, and it does produce that same sort of depersonalization, dissociation that I was talking about. But even in that respect, when you're using cannabis as a medicine, the effects only really last while you're under the influence of the drug. Whereas because of the mechanism of action where these psychedelics are increasing your neuroplasticity, during that session, you're changing your brain somewhat semi-permanently, right? In a way that you wouldn't necessarily get if you were just going to a therapy session where you could just block things out. It kind of makes you feel.
Yeah, I feel like this is more of creating connections in your brain than
Exactly.
Wouldn't the brain just, the sensitivity to the serotonin receptor, wouldn't it just be less sensitive to it over time, and thus not leave it non-functional, which will create more harm than originally intended?
Anytime you're overstimulating the receptor, you're gonna gain a tolerance, right? But in this case, you're taking a small dose once a year. You're not gonna change that much at all.
I would imagine for that case, it would have to be above a certain threshold for a long enough duration and that may be something that we have to study to see what that is. We may not know what this parameter is.
Exactly.
Well, I mean, we see a lot more complications if you're taking psychedelics consistently. I mean, if you're taking high doses consistently, it puts most people into psychosis, like permanently. So it's definitely something where it should be under the supervision of a physician or a therapist or something. And you shouldn't be, see, right now there's like ketamine therapies that like Big Pharma is trying to push where you like put a ketamine stick in your nose and I'm completely against that because you're basically just giving patients this ability to get high
do it anytime.
And do it at any time, right? And you're not adding in that therapy, which is a huge part of the effect because really it's almost like a neutral stimulus, right? It's like saying, okay, this drug is saying, okay, neurons, let's reorganize. And if you're not in the right setting, it's not going to produce the desired effect.
It could go negatively.
Right, exactly. Yeah, if you're in a bad mindset, in a bad setting, and you take it, then you could possibly have more depressive or more anxiety.
That's crazy. Well, that makes sense, but also, wow.
Yeah.
So then, how would a person with depression be able to take it? Because usually that kind of thing hangs over your head for a really long time, and it's usually sometimes it comes up in short bursts throughout the day. So it's really if it's going to make your symptoms worse if you take it in I'll call it a bad mood for lack of a better term. When would you take it then?
Well, I don't think it's necessarily the mood you're in. It's like, what do you do with it? So if you're in a bad mood and you're thinking, I'm helpless, that's probably not going to help you. But when you're in this like setting where you're with a professional who knows all about mental health and like how to help you through this thing, like you're not really employing any different therapy techniques. It's just like you're working through a mental problem with someone that they otherwise would not be able to overcome without the effects of the drug.
Yeah, so I think these kind of drugs are kind of like an amplification of what kind of nutrient, right? So you need to be in the correct setting. You need to have like the correct mindset, when you take this drug, or else it's going to have the negative effect that you're talking about. Because if they're already in a bad mood and then take this kind of drug, just thinking that, oh, it might help, they'll probably be mostly thinking of the negative. And our brain usually don't process the word can't. Because if you say, oh, don't think of an elephant, and then you just think of an elephant, right? So it can't process the word can't. So it just doesn't. So if you think, oh, this drug can take away the negative, and it doesn't, then the word negative is going to be amplified. So you do need to be in the correct setting, correct mood, which is why it's important to be with a professional while you take it.
Yeah, and they can kind of guide you through those emotions. So you're not lingering on something, and you're actually trying to move past it in a healthy way.
So what I'm hearing is we're all going to South America to do ayahuasca.
I mean,
I was thinking about
if you want to front the money,
But the thing is, there's one thing that's going to affect the results significantly, and that will be the fact that there is no really way to assure whether the patient is or is not in a current mindset. And this is going to go into the existential side of things because you can't really know what someone's thinking or be assured of something. So for all you know, the patient might just be saying, agreeing and saying yes without really feeling that. There's no way to verify that. They take it, and the bad results, never take the positive side of the results, and the research basically ends up all relying on what the patient feels, which is not guaranteed to figure it out on a different point of view, so end up being this perpetual cycle of not knowing what to do, pretty much.
Sort of. So that's sort of true with the surveys they do, right? But they link that with fMRI, and we know different regions of the brain that are associated with, say, emotional connection, where, okay, if you take an SSRI, standard antidepressive medication, it decreases just emotions overall and ability to emotionally connect with someone.
Right.
These show on brain scans it does the complete opposite. It increases your emotional capacity to connect with someone else. But yeah, I mean, when people are anxious and they're taking it in these studies, they do end up like quitting the study. But this is like 10 to 20% of the participants, whereas with SSRIs, the positive effects are only reported for about 50% of the people, and then the rest of them are just basically turned into
Zombies.
Sexless, emotionless zombies. Yes.
Pretty much.
And this is great. We're prescribing these to minors all the time, and they're addictive, and they cause withdrawal symptoms. It's all good, right? Because people stand to make a lot of money off of it. And I think this research is specifically not being talked about very much because
it doesn't make money.
Right. So what is CNN going to report on something when their business partner is going to lose a bunch of money if they report on it? I don't think so. Yeah, I mean, all these concerns we're talking about with this drug are concerns that are the same, if not more problematic in our current system. So, I mean, yes, we should address them, but why don't we address them with the current, you know?
I'm glad that you brought that up. I think it's a very good perspective to bring the conversation. That, like, hey, yeah, we can talk about this thing, and this is what we're arguing. I appreciate that because it does help inform the conversation.
Yeah, it's like the best we've got, the status quo right now, is much worse than the experimental drug, you know, even with the little data we have from the experiment.
I mean, that gets into a whole lot of other areas on how to fix the current status quo.
Hey, it's an open discussion. We can wander.
I like that. It's more fun. So, can I pose a question then?
Yeah.
What do we think of, given what we just learned, what do we think of, like, going back to the first question, like, should we implicate or put this into work now, or do you think it'd be smarter to wait? What would be a timeline for this? What would be a smart time to do?
Personally, I think right now, so I don't know if you've noticed, there's ketamine therapy centers everywhere. The only reason that is allowed and not psilocybin is because ketamine is well researched as an anesthetic. And that's actually the whole origin of how we figured out psychedelics reduce depressive symptoms, because patients who are given ketamine felt less pain weeks after than patients that had another sort of non-psychedelic anesthesia, right? So they required less like opioids, they required less, right, just less pain medication. They reported feeling happier, and so the researchers said, what's going on here? They realized, okay, ketamine increases neuroplasticity. What else does this? What else binds to similar receptors? And now we're seeing this whole kind of renaissance of researching into these drugs, which were historically prohibited and have all this stigma surrounding them because of the sort of political climate of the 60s and 70s.
I don't think there's a point, sorry.
Yeah, go on.
Are you sure?
Yeah.
I don't think there's a point in waiting. I think like this needs to be something that we do now, because I feel like we've waited for so long and things aren't getting better. And quite honestly, for humans, like our weakness is society, and we're all influenced by society and what other people think. So I think that in general, also with mental health, that just makes it worse.
Right. So let's try to avoid the cultural manipulation.
Yeah.
Yeah, I would agree with you.
Yeah.
I see if this works out. If this works out, like if this creates more meaningful relationships and like just feeling better about instead of like numbing your emotions, you're actually more in tune with them. I think it would also make people less depressed too, by proxy in a way, just because people are more open and things like that. And so it's not like, so it actually like helps. I know you didn't bring society into it in this perspective, but I think that it would help overall. It has a lot more benefits than like SSRIs, which is just managing your emotions. So yeah, timeline wise though, I feel like as long as we try to figure out the mechanism and kind of focus on adults first, then maybe you can kind of start doing like child studies too, and then go from there. But I think, yeah, I don't think you should.
Yeah, I like that because you're kind of bringing up the matrix effects of it, right? You're increasing someone's capability to form these emotional connections. People also report feeling more connected to nature, and that would increase your kind of, I guess, will to go outside and do something, that which gives you vitamin D, fresh air, exercise, right? And so you're improving all these factors just by proxy.
Yeah.
I mean, my timeline, I think, is going to be a bit different. I think implementation should be restricted to the worst situations, because as we said, this kind of thing works best in the high intensity situations. While more research can be done, again, figure out the mechanism and then distribute it widely. My fear, though, is if you restrict it to the most intense situations, what's stopping big companies from saying, okay, we got an insulin situation on our hands. We can jack up the price of this drug, and people will have to buy it because they're in such an intense, shitty situation. So, if you restrict it that way, how do you stop that effect from happening?
Well, you can't grow SSRIs, but you can grow mushrooms.
True.
But how do you measure the dosage though? Like, you still have to.
Yeah,
Yeah, you can grow it, but don't you still have to like make sure you're getting the right dosage?
Yeah.
Yeah, I mean, generally it's by weight.
Oh, that's it.
Yeah.
You don't have
I mean,
to like.
there's going to be variance in concentrations, but if you say have a company that comes out, and of course there would be many, which would bring competition and lower prices. That has like a grow kit that has specific nutrients in the soil that will produce consistent results.
The thing is, I personally think we should take a hybrid approach. Not, of course, not fully make it physically advertised fully, and at the same time not make it only for a worst case scenario, but take the in between. Make it first for extreme cases, make it available for that. Of course, there has to be actual moderation, so the companies will like jack up the prices, and also make sure that this is actually public domain knowledge, so people can know they can go right regardless. But at the same time, we don't want like normal people to use that and end up creating bad effects, thus ruining all the good effects we're trying to achieve. So kind of in between, pretty much, kind of let it in, but also not go all the way in while controlling it at the same time, and hopefully avoiding all the worst case scenarios that could potentially happen if we just let everything come up, pretty much.
My thing is like, the reason you can't, okay, so obviously technology is not widespread enough to make their own drugs. So obviously that's why people can't make them. But also, companies have patents on a lot of these drugs. So what's to stop you from growing the mushroom and then getting sued out of your ass because you grew the mushroom?
Well, that would have to be if there was like a specific strain of the mushroom that was genetically modified, because that's the only thing you can really like patent in terms of plants and funguses. Like, I mean, many companies grow cremini mushrooms or white button mushrooms or portobello mushrooms, right? But if a company specifically makes like flavor saver portobello mushrooms, then you can't grow those, but you can still grow the natural variety. You can't copyright nature.
Yeah,
I like that.
Imagine copyrighting the word tree. The word trees alive.
But I mean, I think it's important to stress that widespread rollout of this can save a lot of lives. Like, depression is not just a state of mind, it's a life-threatening disease, right? And when you have something that's more effective than what's currently out in the market with less negative side effects, it's kind of morally wrong, in my opinion, to not roll it out widespread.
Yeah, with the rates of suicide increasing and depression increasing and anxiety increasing, like day by day, it's not going to get better unless we do something now. That is a different approach that might help and be more beneficial.
so in that in mind, the second highest cause of death for teenagers is suicide, right? Behind car crashes. We seem to have problems earlier with testing this on minors. But if the alternative is suicide, I think that research into that would be very beneficial. And I mean, you could start it with cases where people are saying they're going to kill themselves, they're in mental hospitals, and instead of prescribing them a drug that's going to turn them into essentially an emotional zombie, you give them one dose of a mushroom that gives them an experience, you get them through the therapy, and then you see what happens.
I don't know, with that kind of thing, like, I understand what you're saying. It's a life-threatening disease, and if you have the means to stop it, to do so is ethically wrong. But you also got to consider these people aren't in the most sound state of mind. So
can they make it like?
Can they make
autonomy of choice?
Yeah, can they make an informed decision? Can they do informed consent?
Right.
And I understand that's a pretty hot topic issue, and I don't know how to solve it. So what do you say?
Yeah, like I mean, isn't that the same thing with prescribing them other drugs though? Like they also.
Yeah, like medical marijuana.
Really
No, what I mean is like when if you're gonna bring that up, right, we would have to ask the same question when they're prescribed other antidepressants as well.
Like,
And right now, like
the risks, right? Like, yeah, if you're desperate, I'll take anything if I think it's gonna feel better or make me fix my problem. Right?
Yeah, and I've had many friends who've suffered from taking SSRIs, and then they have to quit, and then every day for 2 weeks they're full of rage and they're depressed again. I mean, like they would only work for them for so long, and then you build up the tolerance to it. It becomes not very.
I finally
How about
have
that,
a book.
Shanbhag?
I have another question.
Wow,
Because we talked about
more faces.
Yeah.
Hello.
we talked about neuroplasticity, right? I know there's like slight association with like intelligence and IQ, and that's like at least from the conversation I remember, that's like the best metric right now, or most like non-subjective, the closest to common metric. I wonder how the modulatory effects of neuroplasticity affect like intelligence.
Well, so I think in someone who's just more intelligent, their neuroplasticity is greater all the time, right? Whereas the neuroplasticity of these drugs is acute, right? It's during the session,
Right.
That's when they're going to experience those effects. And I mean, I'm just going to go out on a limb and say people are slightly less intelligent in things like math and stuff when they're under high doses of psychedelics. I mean, I could be wrong. I mean, famously, a lot of researchers have taken it to inspire them.
Well, you have to be out on a limb and go way out to think like that, to be able to study.
Yeah.
If you never consider those as options, you never look into those issues. Because last time we talked about, is intelligence dependent on indoor learning or outdoor learning?
Yeah.
Or carbon monoxide level or carbon dioxide level? Does it make people intelligent, unintelligent? So some of the obscure questions lead to some good results. So you have to think out there.
So just to catch you up, Dr. Shanbhag, we're talking about research on psilocybin and how that affects
I
depression.
have a student in my class who is going to study. There is a field called mushroom research.
Mycology.
Huh?
Mycology?
Mycology.
Yeah.
She's in my class, so I'm going to ask her to come in here.
Yeah, please do.
So she'll be studying that.
Yeah. So 6 months to a year after, 80% of participants still feel antidepressant effects from one dose.
No kidding.
No kidding.
So it's not just magic mushroom.
And it's and they report 50% decrease in depressive symptoms, and it increases your capabilities for emotional connection, where current SSRIs make you less emotionally available.
Interesting.
So it seems to solve the problems that it kind of creates, the current model.
I see. Very good.
So we're kind of discussing the morals of sort of right now testing them on minors and stuff, because second highest cause of death in minors is suicide. And so if we could save lives by researching them.
Yeah, I think it'd be useful to be able to see what the long-term effects are.
And then also I think what would be important is like dosage rate, because
Yeah.
like right now we're looking at like once every 6 months, once every month.
Right.
I wonder, like, are there more negative side effects with more frequent dosing?
Yeah, like getting all the parameters out there, that'd be smart.
Yeah.
It makes me kind of want to go into this stuff, like really stick to research.
This is why I
Because
did
it's
the
not,
neuroscience.
it's never ending. This kind of stuff never ends.
Yeah.
Because you never have a end goal here.
Yeah.
It just keeps growing.
And it's a renaissance right now for
Right.
research into these chemicals that for so long have been prosecuted by the government and
Right.
stigma surrounding it. Meanwhile, all the legal drugs are far worse for you in a lot of cases.
Yeah.
Because, they're addictive.
Profitable.
You need them every day. So it's more
They're always
profitable.
profitable.
And you can't grow them in your home.
Even like heart medication, I think stemmed from mushrooms. So, like I think hypertension, like a drug that controls hypertension. I was reading this book about the heart, and that's how they found it. So it's pretty interesting. Yeah.
Yeah. Also, lion's mane mushroom, completely non-psychedelic, increases neuroplasticity and has these sort of neurotropic effects.
It's going back to what you were saying about like maybe having something that fills the same role.
Yeah. So I'd be interested to see maybe if you eat lion's mane every day, if it would have the same effects as like one dose of mushroom, like psychedelic
And
mushroom.
the thing is, you gotta find enough lines.
Yeah, they're pretty expensive. They're like $18 a pound. Too.
And also, lions are going way on the rare side right now. Especially like, as you know.
No, lion's mane mushrooms. Not like the fur of a lion.
Oh, I heard lions. I'm like, wait a minute.
Very good.
Yeah.
Very good.
Like I used to come from Morocco, like lions there are like very like the dominant lions that were there are going like kind of on the rare side. So I was like, oh, we gotta find a way to.
Yeah, no, we're not poaching. We're not poaching your
That's how we
lions.
lost
Lions.
The decomposers.
All right.
Something that like you brought up too with finding out the mechanism. Like as soon as you said this too, I was thinking about like well, I'm pretty sure there's maybe there could be some relation to like certain types of meditation and creating that same sort of feeling too. So like if you find out that mechanism and also this is just interesting. Like if we could study too like mechanism with more meditation as well and see if there's like a parallel with that. I feel like that would be cool. So then we could people who don't want maybe if the drug has a bad effect, maybe that somehow.
Synergism.
Yeah.
Yeah, we can also try
Synergism.
things in conjunction.
Yeah, like instead of just mushrooms and psychotherapy, you could do mushrooms and meditation, or mushrooms and psychotherapy and meditation, and see if there are any compounding effects.
So back to what you're saying, like maybe the qualifiers that we have this set up, we have these baselines and that before this sort of intervention is even looked at, and try to address like what the optimal synergistic effects are on maybe certain habitual things along with the chemical intervention. It is really cool. I can talk about this all day.
I think the main thing is like we in science, even though we want to test new ideas and stuff, it's so limited. Like it's actual like the way that what we can test. Like meditation, it's really hard to test that, and
Yeah.
ritual things also very hard to test that. And I think that's why like we maybe are focused solely on just one drug dosage and then going from there. But yeah.
I participated in a study here of guided meditation in the mornings and its effect on heart rate variation.
Oh.
Which heart rate variation, if you have a higher heart rate variation, you're less likely to do like impulsive things, like say smoke a cigarette or eat sugary foods or drink alcohol. If you have higher heart rate variance, which you can increase by meditating, deep breaths, etc. I found that very interesting. I did it for 2 weeks.
Yeah, and apparently you can even control your systolic and diastolic heart rate too. Like you can train yourself to do that. If someone kind of measures your heart rate, like your diastolic pressure and your systolic pressure, then if you keep getting feedback like this one's increasing whereas this one's decreasing, then you will know like which mindset to be in to like control those things other than your physiology. Yeah.
I know you were trying to say something.
So yeah, if you're looking into research into that synergistic thing. The guy, like the pioneer of this, Paul Stamets, he does a lot of research into meditation and mushrooms and combining those two together. So yeah, I think read a couple of his papers.
What was his name?
Paul Stamets.
Yeah. He's like not even a PhD or anything, but he does a lot of fruitful research. It's really cool.
Cool, thanks guys.
Sure.
Sick.
I know music therapy is also effective in people with autism. I don't know how applicable that would be to someone who has depression, but I know I studied a little bit in high school about music therapy and its effect on people with autism, and it was pretty beneficial, but that's like a non-drug approach.
I think that's interesting because I mean we all are aware of like the psychological impacts that music can have.
Well,
I never thought of it.
it's an obvious thing because we have exhausted, if you look at the interventive, the medicine, chemical-based repairs, we have kind of reached the limit. Now we are going back to old systems where people use the herbal therapy, people use the yoga, people use the aromatherapy, because these are non-exact sciences. See, music, aromatherapy, yoga, or these meditations, these are non-exact. So there is never a zero effect. Anybody can say, oh, it's because of meditation, oh, it's because of this. There could be 500 other effects there, but you are statistically suggesting because of this. So it becomes more like okay, it is because of yoga, my heart rate got controlled. My cancer was cured because of this. So there are people who, if they say that, nobody is going to refute it. Because you firmly believe that it is because of this, I am now calm. I am not suicidal. I am not angry anymore. Right? I don't go ballistic. It's because of this. So there is no metric there.
Right.
The feelings don't have metrics. Right? And I think this is why these kind of researches can lead to interesting, but sometimes results that are what you want.
It's slippery.
They're not exact, and that's the kind of thing that I was talking about with the scientific method. We might have to like kind of make it a little bit, I don't know, there might have to be tweaks to the actual system and which
Well, do you really need that? The question is, do you really need exactness? If you think
exactly.
if you think for ages, right? Peyotes, people doing mushrooms, people doing these, wild chants or fire walking and all that. Those were therapies people considered as part of their life.
Yeah, and psychology and neuroscience is not an
What's-
exact science in
what's-
itself.
what's
because
wrong?
there's so many variables that are so uncontrolled.
Correct.
And how do you even do a placebo for meditation
cares?
or yoga or
Right.
like,
Right. So at some point you go, who cares? Right?
if it makes you feel good,
It just makes you feel good. It's interesting. I'm gonna take you somewhere else. When I go to my garden there, right? People walk in and say, what is this good for? What is this good for? I'm going, it cures cancer? Does that make you happy? Right? So they what is this good for? I go, listen, these were what people, my great-great-grandfather, your great-great-grandfather ate, survived, and they aged to the point of, reproduction. That's why I'm here. If they killed themselves, if the nature killed them away, I would be here. Right? The fact that people have survived because of these type of therapies, right? We are here. Now, do we need a reason for it? Do I feel good when I smell this? Yeah. Okay, my life expanded for another week. So everyone wants to have a disease association. Any therapy, you would say yoga plus cancer, right? Meditation plus non-suicidal. So you always want to make that result oriented, what do you call, value to these events. Mushrooms were just fun.
I mean, they weren't just fun though. Like,
People were having psychedelic effects.
yeah, for
Right.
spiritual reasons most.
Right? So they did it for ages. Now we are trying to find science in it. Now, if we don't find exact result, don't just abandon it. Our hypothesis was wrong.
Right, we can.
Because we tried to make a connection to a wrong place. We should have made the connection, it's just good. It's fun. That should be enough. But when we try to make exactness in a non-exact science, we might reach a wrong result. But some of the traditional things, some of the traditional medicines, traditional, the acts, just the acts, those were for longevity. And people are trying to find now what is the benefit of meditation. Is it necessary? You don't have to find the benefit of meditation because it has been beneficial. Nobody has essentially put a value to it. They made it part of their life.
Yeah. How do you put it
How do you
numerically?
quantify it? How do you quantify it? You can come in.
I didn't agree.
Okay.
I feel like the
You are new.
I didn't agree. I'm sorry.
Okay.
I feel
Well,
like
we're about to end the.
yeah.
We had a very interesting one. There are two students in my class.
Alright.
One of them is a
I'm
mushroom
ending the
researcher.
recording.
Other one is
Thank you,
neuroscience.
everyone.
We gotta drop them here.
That was super fun.